Now we'll have a look at the anti-epileptic drugs. Brivaracetam binds SV2A, sedation, dizziness, and fatigue and irritability. Adverse effects: carbazepine, sodium channel blocker, hyponatremia, drowsiness, fatigue, dizziness, blurred vision, neutropenia, leukopenia, thrombocytopenia, pancytopenia, and anemias. Devalproex, multiple mechanisms: weight gain, eye bruising, nausea, tremor, hair loss, GI, liver damage, alopecia, sedation. Eslicarbazepine blocks sodium channels, nausea, rash, hyponatremia, headache, sedation, dizziness. Ethosuximide blocks calcium channel, drowsiness, hyperactivity, nausea, sedation, GI, upset, weight gain, lethargy. Felbamate, multiple mechanism: insomnia, dizziness, headache, ataxia, weight gain, and irritability. Gabapentin, mild drowsiness, dizziness, ataxia, weight gain, and diarrhea. Lacosamide, multiple mechanism: dizziness, fatigue, headache. And this is Schedule 5 drug. Lamotrigine, multiple mechanism: nausea, drowsiness, dizziness, headache. Levetiracetam binds SV2A, sedation, dizziness, headache. Anorexia, oxcarbazepine, it is a sodium channel blocker, nausea, rash, hyponatremia, headache, sedation, dizziness. Perampanel blocks AMP, glutamate receptors, serious psychiatric and behavioral reactions. Phenytoin blocks sodium channels, gingival hyperplasia, slurred speech, double vision, ataxia, sedation, hedonism. Pregabalin, weight gain, somnolence, dizziness, headache. Schedule 5 drug. Rufinamide, shortened QT interval and multiple drug interaction. Tiagabine blocks GABA uptake, sedation, weight gain, fatigue. Topiramate, paresthesia, weight loss, nervousness. Gabapentin, vision loss, anemia, somnolence, fatigue. Zonisamide, nausea, anorexia, ataxia, confusion, difficulty, concentration.